Hello, hello, hello. Welcome, everybody. Today, I am going to talk about gut and brain health, and I apologize I'm 5 minutes late. It's just kind of the way it is when I work with patients, right? So today, the real focus is gut and brain health. The first thing I want to talk about very and so many of us are living in this sympathetic state, this drive, this go, this fight or flight. And we're constantly running, and we're never stopping and breathing. And then you ask me, like, how does that affect your gut? How does that affect your digestion? So the truth is, this is how it affects your digestion. If you're just eating really quickly and you're not stopping and chewing your food and being really connected to like the smells and the flavors and what you're eating, then you're really not telling your body that you're digesting, right? So if you're eating on the fly, then you're not preparing your digestion, your stomach acid, your vagus nerve, which we'll talk about in a minute. You're not being in that calm state. So how can you digest? It's an issue, right? So here's what I want to say. When you take a piece of food and you chew it. Well, first of all, I want you to always sit down and eat. I don't want you to stand up and eat, which is against like my motto. Like I'm always saying, move your body. If you can stand and work like I am and stand and go live, like that's the best thing you can do, right? But in this case, I want you to sit down and I want you to think about taking some few deep breaths while you eat. How many of us do this? I want you to put breathe in the comments. Do you breathe right before you eat? Do you really connect to your food and say, like, I just can't wait to eat and I'm taking in all these smells and I'm in a blessed space and now I'm going to eat? So then I want you to think about chewing your food 10 to 15 times, right? So the more that you take in and you focus on your food and you're chewing it 10 to 15 times, you're actually preparing it for the stomach where you need B12 and pepsin. So if if you have a B12 shortage and you're in that sympathetic state, that drive, that go, then how can you expect your digestion to work? So then you chew the bolus of food, you relax, you take in the food, you digest it, you're breathing, you're enjoying it. It's going to go through the esophagus, into the stomach, like I said, where you're going to need the HCl, pepsin, B12, and then you're going to, once you chew that food and prepare it, then you're sending it to the small intestines. And that's where it absorbs into your cells. I always say, if I want to be an organ of any kind, I want to be a small intestines, because small intestines is what decides where my nutrient absorption is going to be, right? So then at that point, if we don't need what we need after we chew it, then we send it to the large intestines. Once it's gone throughout the whole body, the large intestines absorbs water and salts from the foods that have been digested. And if we don't need it, we get rid of it. It becomes waste, which is what we talked about yesterday. It becomes waste. Intestines, if it's full and it's not constipated, then it's going to absorb certain nutrients for the body to continually work. So what is really happening with many of you that have gut problems? What is happening is you have this imbalance of nutrition. You're not eating the quality foods like we talked about yesterday. Go back and listen to the video so that you kind of get an idea of like pre and probiotics and vegetables and fibers and things. You are stressed because you're not resting to get into that parasympathetic, that rest state. And then you're getting gut symptoms. And that's where your gut microbiome, meaning the healthy, like that healthy, almost kind of like when we prepare plants and we get the soil prepared, like that's the healthy soil in our gut. So when that becomes disrupted, then we end up with digestive symptoms. If we chew our food, we have motility in the digestion, we have the saliva, we have the hydrochloric acid, we have the B12, we have the enzymes, the gallbladder releases what it needs, the small intestines assimilates the nutrients, we have the right hydration, we have the right electrolyte balance. Guess what? We have a healthy gut. We have the right diversity. We have no pathogens. We have what we call tight gap junctions, secretory IgA. Like our immune system can function well, right? So really, guys, like this is so important. If you were just like, I'm going to just grab this food at this restaurant, or I'm just going to grab the food that I meal prepped. I took the time to meal prep it, but I'm just going to eat it. I want you to be real, because that, even when I just did that, I'm feeling anxious. Now, how could I digest if my brain's going to feel anxious? And the truth is your brain doesn't know the difference between anxious, like I'm going to run away from that bear, which many of you have heard me talk about, as opposed to like, I'm just in like a stress state. Like it doesn't differentiate. And most individuals run on that stress, right? They're constantly in that stress. Then when we actually look at the gut microbiome, right? The soil, the richness of our soil, we hit so many areas from the gut microbiome. We're connected to the lung, it's connected to the skin, it's connected to the oral cavity, the vaginal cavity, the nostril cavity, the gut brain axis, which we want to talk about today, gut thyroid, gut pancreas, like the gut is connected to everything. So when I'm asking you to take those deep breaths, that vagus nerve comes from the gut and goes to the brain. It tells the brain to get into a calming state. Oftentimes with SIBO patients, which is small intestinal bacterial overgrowth, that means like the microbiome from the gut gets into the small intestines, the unhealthy neighbors, the unhealthy gut microbiome, and it causes symptoms. I would tell you, when I work with those patients on calming the nervous system, that's when we get results. That's when we get results. So when we're eating foods and we're not digesting them well, we can actually be like not getting the right nutrient absorption that we need. And those unhealthy food choices that we're choosing can cause what we call toxemia. So if we have unhealthy food, unhealthy lifestyle, we could possibly have some genetic deficiencies or susceptibilities, I should say. We end up with nutritional deficiencies and our food allergies, gut imbalances, which is in our world a fancy term, dysbiosis, and increased intestinal permeability. Then our metabolism becomes off. We could possibly end up with autoimmunity. We can get systemic toxemia. And then we get all these clinical diagnoses. But yet, if we ate our foods and we ate the foods that worked for our body type and who we are as an individual, we could alleviate a lot of that. So it's so important for our body to remove the toxins that it no longer needs and stop the preventing of production. And by doing that, we want to optimize our gut flora. The gut flora is a major component of toxic exposure, because remember, the mouth to the anus is to the outside world. And we want to make sure that what our body doesn't need, we get rid of. So let me just take a few minutes and talk about brain. How does the gut work with the brain? It's the vagus nerve. If our gut is imbalanced and we're not feeding it the right amount of foods, the proper fats, the proper proteins, and we have an abundance of sugar, which we talked about yesterday, we don't think and concentrate well. I know it's deeper than that. It could be thyroid. It could be autoimmunity. We could be dealing with Lyme. Like there's so many things, but I'm trying to bring it back to the surface level for you guys to think about. Because the truth is if I don't, you hear me say this all the time, if I don't heal blood sugar imbalances, blood sugar can cause inflammation. If I don't heal that in a patient and they're constantly having that inflammatory factor, the inflammation gets into the gut and gets into the joints and gets reabsorbed back in and putrefied from the large intestines and back into the body. It's got to go somewhere. We have the brain. So when we heal our gut, we heal our brain. That's why the gut is called the second brain. Sometimes in my clinical experience, I feel like the gut should be called the first brain. Because like things that happen in the gut, that gut feeling that we talked about yesterday, that gut instinct. Do you ignore your gut instinct? Say you're going to step in to do something new and your body's like, oh no, you really shouldn't do that. You really shouldn't do that. There's a difference between fear and gut instinct, by the way. If your ego is telling you you're fearful, step into it. But if you're really feeling it in your gut, like, I might not be safe. That sense, like that's your brain, that's your gut. Like so many people don't go with their gut feeling, even in medicine. Like I say to a patient, like one of the questions I ask is, what do you think is wrong with you? Because that guides me. And that may take them all the way back to childhood. So if they've had a trauma in childhood, until we work through that, the brain isn't clear. The mind isn't clear. So, when we're looking at some of the cravings that happen in the GI, by the way, cravings are not normal. Instagram, Facebook, YouTube. So when we have cravings, we have an imbalance. So with cravings, we can either get sugar cravings. So when we have GI symptoms, we can get sugar cravings, which is probably too much sugar. Could be an overgrowth of yeast, but I'm guessing. Please don't quote me on this. And remember, nothing that I'm teaching you here is diagnosing and treating you. It's merely just giving you information. Reach out to me and put support in the chat if you need support, because I'm here to support you. I just show up and do this because I love all of you and I want you all to have an amazing life. I just read the other day, 50% of the people in our country in the US are going to be overweight and obese and have blood sugar problems. The blood sugar problems are causing by 2030, they're saying 30% of our population will have dementia/Alzheimer's. I don't know about all of you, but when I get to be 80, 90, 100, I want my brain. It's all the sugar. I have patients sit in my office and say, we're not eating sugar. And then I have them give me they're not reading the processed food label well, which we'll get into. Remember, I'm teaching a gut brain class at the end of the month with a challenge that you all may want to get on. It's going to go deeper. Right now, I'm just teaching surface. So when we have GI symptoms, let's go back to that. Sorry, I get off track sometimes. I get obsessed with this. So when we get our gut off track, we can have sugar cravings. We can have anger, irritability, depression, sadness, anxiety, high levels of stress be thrown off, difficulty concentrating. If this is you, put like cravings in the chat. Let me reach out to you, because there's little tweaks that you can do. Obesity or overweight. Then the general gut symptoms that most of us know are bloating, diarrhea, constipation, headaches, migraines, abdominal discomfort, OCD, believe it or not, can be. These are all can be's. Hormonal disturbances, and then skin conditions. So I ask my patients, which I want you to ask yourself, is after you eat, do you experience any changes in your abdomen or gut or energy after you eat? Again, do you experience any changes in your abdomen, in your gut, even your bowels, or energy after you eat? I have patients, as soon as they eat dairy, they have diarrhea. So then why do they keep doing it? Why do we do this to ourselves? Why are we eating foods that make us feel like crap? Like, why aren't we eating foods that make us feel good? I'll never know. I don't know the answer to that. I don't know. So I want to go over again the nutrition that will give you a healthy gut and give you a healthy brain. And guess what? You guys all guessed it. It's whole foods, not processed foods. It's whole foods. It's vegetables in multiple colors. Do seaweeds, you can do psylliums. Those are high fiber foods, prebiotic and bulking. Fermented foods we talked about yesterday, right? We're looking at sauerkrauts, pickles, kimchi, pickled vegetables, pickled beets, pickled cucumbers, which are pickles, right? Natural antimicrobials that really help the gut. If you don't have a diagnosed condition of SIBO, you want to be careful. Garlic, onions, apple cider vinegar. Superfoods that are anti-inflammatory for the gut are going to be your berries, your quality oils, right? Yesterday I talked about like production-based oils that are not good for our gut and our brain at all. What you get to remove, let me go back for a second. And healthy fats you need for your brain. Your brain is 80% fat. So why are we telling people to stop eating fat and that's how they'll lose weight? How you lose weight is balance your macros, move your body, exercise, get into a calm state, digestion. When we exercise, why is that good for the GI? Because it's the circulation. We're getting the circulation moving. We're getting our body moving. We're moving lymph. Like that's why that's good for the gut, right? And water. So healthy fats, what are those? It could be salmons, it could be sardines, it could be fish oils, it could be barrage oils, it could be flax seeds, chia seeds, flax oils. Like those are quality fats for the brain. So in order for you to focus and concentrate and not have a drop in energy, we want a balance of our macronutrients. Again, protein, vegetables, fats. I know I keep going over this, but until we get this hit home and we remove certain foods that make our gut unhealthy, which are processed foods, saturated fats, sugars, alcohols, certain grains, and dairies. I'm hoping this all makes sense. Like, because all of this working together that I always talk about helps stop us from healing. Our body believes every word we say. So if we've had trauma, if we had abuse, bless you. Please work through it. Please get support. But the basics of natural medicine and the basics of gut health are to find foods that work for you. Bio-individuality, right? So I am here to support. There's so much that we get to do with you, and figuring out what works for you is what is key. Figuring out what works for you is key. Creating a customized treatment plan. And the other key is to know, what are your labs? Please don't ignore that. I get my labs done, taken 2 or 3 times a year. And then if I need specialty tests, I do as well. So I practice what I preach. And so many people say to me, the beauty of working with you is that you're teaching me to become a more vital me, and you're practicing and walking your talk. And that's key. So many people reach out and get strength coaches, running coaches, business coaches. But how about getting a healthcare practitioner, health coach, somebody on your side so that you feel like your best self, so that you can do all these things that you love? That's where I want to close. The doors are going to be opening for the Wellness Connection. We're going to be talking about it a lot. I'm bringing people in, 100% support. You get me, but you get a customized treatment plan. You get a customized treatment plan that's bio-individual for yourself. So ask me questions. If you want support, put support in there. If you have gut issues and you want to ask me questions and jump on a call before you join anything or do anything, put gut. Put gut in the comment section so that I know all of my listeners that are listening right now what they're struggling with, because that's how I can help you. And my last ask of you is if there's anything that you want me to talk about and share going forward, like this month is about gut health, just let us know. It's really that simple. I'm sending you guys so much love. I hope you have an amazing day. Please let me know if this is helpful, and just keep going, because every time you make one change, 1% of the time, you're one meal away from getting yourself back on track. You're one meal away. So much love. Have an amazing day. Happy spring. We'll talk to you tomorrow. No, sorry, we'll talk to you Tuesday.